Hi, I'm Susan Moore for Spirit of Women and Banner Health. We Spirit members are so fortunate to have the most wonderful doctors in our community who are willing to share their advice, their knowledge, and you don't even have to go see them at the hospital. You're going to get the scoop here today with Dr. Christy Young, and we're going to talk about concussions. Dr. Young, why is every other article about a concussion? So, you know, we went so many years when people, big deal, and suddenly you're realizing that this is a really big deal. Tell me, first of all, what is a concussion?
So a concussion would be a mild traumatic brain injury, and that can happen from a blow, it can happen from a hit to the head, it can happen from acceleration, movement, a
like
jolt.
in a car?
That's right, or in a game, football, mini sports. And so I think the reason we're seeing more of it is that we're learning more. And we're figuring out that through research that it can potentially cause more damage especially to a developing brain, that we need to take a little bit more serious and at least go through kind of a standardized way of addressing these concussions.
Is there a typical patient that comes to see you with a concussion?
I would say for me personally, I see a lot of school-related, sports-related concussions, where the coach has appropriately taken the player out of the game after they may be dazed or confused or just don't seem to be quite with it anymore in the game, and they'll take them out. And at that point we have a law now actually in Colorado that the coaches are supposed to take the child out of the game and then be seen by a medical professional.
Thank you, Governor Hickenlooper, for doing that. Yes. That's wonderful. And so symptoms, you talked a little bit about dizziness, but if you suspect your child has a concussion, what kind of symptoms would you see?
Yeah, I think that within the first early phases, often you'll have some dizziness, you'll have nausea. What parents often will see is they just have a different personality, the mood changes, they're not quite right, and it's very concerning. Now that would be a normal phase most often from a mild traumatic brain injury or concussion. And then there's red flag symptoms that would be more concerning.
Now, should the parent or adult who's got these symptoms, should they go immediately or wait it out, or what are the red flags? Is that the sure sign?
Yeah, red flag symptoms would be if you have different pupillary size, if you have vomiting that isn't stopping, if you have a headache that doesn't seem to be going away, certainly if you have weakness on one side. Those sorts of things are concerning enough that that's an emergency.
It certainly is.
That would be an emergency. Otherwise, concussion symptoms, for most, luckily, patients, it'll be a couple of weeks to a few days, and they do better. Now, we found that often people can go on with many symptoms, though, post-concussive symptoms, and that's what I see most of. So headaches in neurology and seizures and those sorts of things.
My goodness, are there any new medications, any new drugs that are miracles?
For concussion, no.
Okay.
Headaches, we can certainly help. I have to be cognizant of the fact that not giving certain kind of medications to, say, our UNC football players or some of our players, we have to be careful that they could get tested for certain things. So we don't use narcotics. And so generally, if they're prolonged concussion headaches, I'll have them on some natural supplements, and I'll have them potentially on a pharmaceutical to help reduce the headaches.
If somebody has experienced a concussion, what are the first steps they should take to recover?
Once you see a medical professional, you can see your primary care pediatrician, neurologist like myself. You want to do that fairly quickly. We will review, usually using a standardized testing to see what symptoms you're having. For instance, if you play sports, it's very important that right after, in most concussions, that you rest. And so we used to kind of say, you know, get up, go, walk
Right.
it off. And that's really not the message right now. And we strongly want to make sure that people understand they should rest their brain. If you have a broken arm, you're pretty clear that you shouldn't go back into the game.
Right.
However, a broken brain, if you will,
yes,
is going to also be something that you really can't see. And so it's extremely important to understand the signs of that. And that's where you have light sensitivity, sound sensitivity, nausea, headaches often. You can be dizzy, you can have mood changes. And so we ask people to rest. And we want them to get to a care provider to be cleared to return to play. So you really want to have a whole process and a team approach like we're doing with Banner. We're having a standardized approach so that we're all on the same page and can actually give the right message to rest before you return to play.
Okay.
So you need to be cleared and you need to have no symptoms whatsoever before you go back into the game.
Great. And when you say rest the brain, does that mean maybe staying off your smartphone for a while?
Right.
Giving things a break.
And that's a great point because often we'll ask teachers to keep students out of physical activity, but then they stay in the room and stay on the computer.
Yeah.
Well, that's also a trigger. And so TV and smartphones and those sorts of things are definitely going to be triggers just like physical.
Okay.
Yeah.
So rest means rest the brain.
Exactly.
All right.
Yeah.
Is there anything else you'd like to share, Dr. Young, or do you think we've pretty much covered the points?
You know, I would just say that it's important to ask these questions, be involved with a group like Banner that is trying to get together and send the same message. So our ER, our pediatricians, and our primary cares are all doing the similar tests and giving the same message for return to play.
All right.
Okay?
Will you be safe?
Thank you.
I'll do my best.
Okay. Thank you.
Thank you so much to Dr. Christy Young, neurologist, filling us in about concussions. I'm Susan Moore for Spirit of Women and Banner Health.